once there is a confirmed case at the business, the health department will then be allowed the roster of employees at that business so they can do proper contact tracing and reach out to the employees directly to encourage testing. We think as we go over the data is really, really strong related to community spread numbers, but one community spread case can lead to 20 or 30 or 40 direct contacts, and then it skews your data. So we think giving our health department more tools here will help us as we move forward with living with this virus. Over the last 3 days, our positive infection rate related to community spread. Why are we tracking this? We track through the state panel. You can see the regional infection rate, but we know that it takes one case in the community that can drive senior-related cases, or it can drive contact cases. So we want to track community spread as an infection rate. Moving forward, our community spread infection rate is 0.3, so a very good number. Universal testing will continue at the Syracuse Community Health Center on Saturday from 9 to 1. It will not be open Sunday, but it will be open 9 to 5 on weekdays. Next Monday we'll go over what our mobile testing program looks like for the week. But again, this week, very successful mobile testing into different pockets of the community. A lot of folks got tested in their own neighborhoods, so we appreciate that. Looking at the testing on a regional basis, 2,121 tests, again, close to triple what the mandate is, so good testing. Looking at hospitalizations, 38 individuals in the hospital, essentially 8% of our active cases. 13 of these folks are waiting to test negative to return to their residence, which is a nursing home. So when you look at this, the reality is we have 25 individuals in the hospital that are still being treated for COVID-19. So certainly let's think of them and their families. 8 individuals in the ICU. These are individuals that are in a fight. Please keep them in your thoughts and prayers this weekend. We look at some demographics on who's in the hospital: 23 Caucasian, 10 African American, 3 of another race, and 2 individuals who have not shared their demographic information. To date, we've had 357 people that have been released from hospitals, gotten better. Looking at our cases, we now have 2,647 positive cases since March 16th. That's up 16. Out of the 16, we have 9 household or confirmed contacts, right? So 9 out of 16. That's where an employee would fall in that category, or if you are positive and someone in your household becomes positive, that's where they would fall. 1 new case related to senior living facilities, excellent number. We are very happy with that. There's a direct correlation with hospitalization rates, ICU rates, and loss of life with our senior facilities. So the fact that we only had 1 new case out of there is very, very good. 2 cases related to travel, and 4 cases community spread. So very, very good number for community spread. We're presently monitoring 475 active cases. That's up 5 from yesterday. 1,993 people have recovered, up 11 since yesterday. Just a reminder to folks, we've seen what's gone on in other parts of the country with infection rates moving up. Each region of the country is different. The scientists will debate what's happening in these other parts of the country, but certainly what we've learned in New York and in Onondaga County and central New York is that certain things work, and physical distancing works, and wearing a mask works. As we move into restart, which we're in a new phase today, there's still neighbors of ours who own businesses and work at businesses that are on the sidelines, and they need to open up. But our job in making sure they open up is to make sure you do what works in this pandemic, and you wear a mask, and you physically distance. There are so many examples where we're getting too comfortable. And if we want to continue to have situations where we have 2 community spread cases or 3 or 4, and gives us time to trace down to the initial root of this virus where we can truly work towards eliminating this, we need to do what works. And so I'm just asking people to remember that we need you to wear a mask. And some of our retail outlets that don't enforce this, you're going to get letters from us. And if you choose not to enforce mask wearing, we'll be there and we'll fine you. So we take this seriously. We've come so far. We're in phase 4 of this process now, but there's still businesses that need to open up, and we need to continue to make progress so they can open up. Saying that, looking at more demographics related to cases, out of our cases, 1,564 have been female, 1,081 have been male, 150 under 19 years of age, 460 in their 20s, 350 in their 30s, 323 in their 40s, 408 in their 50s, 327 in their 60s, 256 in their 70s, 230 in their 80s, 143 in their 90s, and that is the breakdown there. Today, Dr. Gupta is here. I wanted to let Dr. Gupta make some comments and some remarks, and then we'll talk a little bit about restart and then take questions. Thank you. Doctor?
Good afternoon. So good to be here. As every one of you thinking about phase 4 and planning for this summer to enjoy beautiful weather with your family and friends, I want to make sure to present some facts so you can make thoughtful decisions to stay healthy and keep your family and friends healthy and happy. So here are some facts which are unchanged somewhat from last few months. 1, pandemic is continue to show its power, right? It's in full force. As you can see, more increasing number of cases in many states, Alabama, Arizona, Florida, North and South Carolina, Texas, Utah, California, the list is long. We have done quite well so far, but it's not to take a victory lap. I think it's something we really need to be very thoughtful and reflect on what we are going to be doing as we are going to go phase 4. What will happen today and next couple of weeks, you will show the data in next 2 weeks onwards. So what you're seeing today is the reflection of what happened a couple of weeks ago or so. You have to remember the incubation period is about 2 to 14 days, so that's how we see the new cases emerging. Number 2, virus is very clever and very aggressive. We know that this virus preys on vulnerable people and continues to create mystery by changing the way it does presentation in young and old and even very little ones, young ones. No one is spared. It does not discriminate. We have lost many members of our community as you have continued to get information. So far, our community has responded fairly well. We have continued to see our contacts become cases. So one of the reasons which we see in why the contacts become cases is if they're household contacts, were they appropriate precautions put it in place at home? Because of different conditions, sometimes it's not possible. We do offer them outside housing, but sometimes people do not want to take it. Or they kind of intentionally did not pay enough attention to that, which is unfortunate because they feel, sometimes people feel like, oh, we are young. If we get virus, we are fine. But it doesn't stop there. I think that's important fact to remember. Having backyard parties, that's also barbecue and different things as we started to see beautiful weather. It is important that, yes, young and restless become very happy at that time, but who pays the toll is the people who are your either mom and dad, grandparents, or grandparents of some other friends, or your neighbors. This is very important. It's not about only you or me. It's about the people who are around us, because the virus does not see who you are, or what your authority is, or you're young or you're old. We have started to see some community transmission thing. A lot of times our majority, as the county executive have mentioned, is we have seen first in nursing homes, that was quite a bit, and assisted senior livings, because they're congregate facilities. They are close together. Now the numbers have gone down quite a bit there. What we started to see, emerging things essentially, much more prominent now, which we were overshadowed by other things, the families within the household. So what can you as a family member do, protect your own family, by making sure you're isolated? If you're isolated, really do follow the instructions which we provide for the isolation. If you are socializing with your friends, then you follow the same. So the other part is the 30 to 50% of our cases don't have symptoms. They are called asymptomatic. That creates a lot of challenge, because you don't know if any one of us positive here. We won't know that unless we all get tested. So how is the response of the community has been? We have talked about that, I think, about a month ago when I came here. This questions was asked also. Majority of people actually have done quite well in terms of responding, because a lot of it is these face masks, physical distancing, staying home if you're sick, all those measures, washing your hands, have done remarkable return on the investment at this point, for the lack of the better word. And what we want to do is, when we are going to the phase 4, this is not time to really stray away from that. We really need to make sure that we stick to that, because if you want to see the growth in the community, if you want everything to be open at the very control phase, it means we all have to participate in it. It means we really need to do what we are expected to do. It's not about my right or your right, it's everybody's right. That's how we thrive together. So one of those things is what I think, we know that it's very exhausting. I get it. A friend texted me the other day, a few weeks ago. She said, I am tired of this social distancing. So I texted her back, well, virus is not tired of you, which is infecting us. So you kind of select what you want to do, whether you like the virus or you like the physical distancing. So then she laughed and she said, okay, I got it. So the point, what I'm trying to make is, virus is very smart, very opportunistic, and looking for very vulnerability in ourselves. And if we put our guards down, it's going to come and get us. So what are the predictions and goals? We really have to very constantly predict virus's next move, which we do by data, and also by how the rest of the communities are doing. So what we do, we want to do downtrending of new cases. How do we do early detection of cases? By testing, testing, testing. As the county executive mentioned regarding the employers, what my biggest ask is, as we started to, as the community is open, we want to make sure that employers come forward and say, if you have even a one case, if you have a large or small employer, please, please work with us to get them tested. We have a great partner, Community Health Center, or if you can get them through their primary care providers, or you have your own physician who can do that, that will be fantastic, because you want to isolate your employees who are positive and then continue to be productive and stay in business. That's what we would like to do. So we can isolate people. The other thing which we certainly are asking the community to decrease opportunity for virus to infect other people. Think of your parents, grandparents, your loved one who may not have that strong immune system. You are protecting them. When you are putting the mask, you're really respecting them, and that's what we are asking you to do. Physical distancing, you can still have fun with all those things. And with all this, because those 20% of people, if they become sick, 80% recover quite well. 20% who don't do that well, out of those, 5% end up in a hospital and have serious consequences, and they can surge the capacity of the hospital, and that really overwhelms the health system. So we really want to make sure we are there to work together. So I am hoping to count on all of you. So fourth point I want to make is a hope. We will get through this. This pandemic shall pass, and will do so. We need to stay focused in testing, tracking, and isolation and quarantine. Medications trial, or you know, that are underway. Vaccines are being tested. And everyday action of all of yours will shape our future. What happens in 2 weeks depends on what we do today. So yes, I'm very hopeful for the summer. Have a happy summer. I'm going to enjoy summer, but with all the principles of public health, and I want you to all do the same and stay safe. Thank you.
Thank you, Doctor. Restart. Today is Restart Phase 4. It's called Part 1. Certainly, we have some businesses back in the game, opportunities for the community to go and really take advantage of some of our cultural and recreational assets again. So we're happy about that. We still think there's work that needs to be done, and we'll continue to make that case to our partners in the state. And certainly next week's going to be a big week as far as economic news goes for us in the county. 2 sales tax payments coming in that will really help shape where we are, help understand what our actual whole is going to look like. We've been estimating 3 various scenarios, all bad, but we'll then know, and then we certainly know specifically what kind of assistance we would need from our friends in Washington. And again, we're not just facing revenue shortfalls, we're facing potential cuts from state government as well if they do not receive assistance. So that's something where we'll get more clarity next week, and then certainly we'll be acting appropriately after that. So questions?
Brian, John Becker publicly criticized pretty harshly the state for excluding shopping malls, movie theaters, and gyms from Phase 4. I'm just wondering what your opinion is of these kind of last-minute exclusions we saw from the Phase 4 we're in today.
So I'm disappointed that the malls are not open today for 2 reasons when you look at specific to Onondaga County. One, Shopping Town Mall and Great Northern Mall have less, they don't have as many tenants. So there's a rule on malls. There's like a square footage cap that under a certain square footage, some are really allowed to be open. I think they should amend that rule to number of stores, and then these 2 facilities would probably be open. Destiny is unique, and Destiny is a very, very large venue, architecturally significant as far as when you think about it, what a mall traditionally looks like. So when you look at physical distancing, obviously very easy. You get mask wearing, much easier for us to regulate Destiny with mask wearing than events in the community that have been ongoing, and people have seen the pictures, and sometimes there's mask wearing, sometimes there's not. And then when you talk about some of the newer variables being thrown in, air circulation, air quality, certainly when you look at Destiny, again, a different design, better ability to probably address this than other venues. So our frustration lies with the fact that each region is different. Certainly we think in the beginning part of this process, when we were talking about before phases, we were talking about what is an essential business defined by Empire State Development. There was an exemption process that you could be deemed essential. We wish that process was available for Destiny, just because maybe some of the concerns make sense with other buildings. We don't think it does with Destiny. So upset. There's in COVID, 24 hours is like a month. So a lot can happen within 24 hours. I really respect and Chairman Becker quite a bit, and I share his frustration, but I understand where the state's coming from when they see things happening in other parts of the state potentially, or other parts of the country as well. It's about finding balance, and I think we can find the balance and get these facilities open in the central region. I haven't heard as much talk about gyms. Again, I think we can regulate gyms. I think gyms should be open. I don't have the ability to open gyms, and I don't have the ability to open malls. So there's certainly disagreement right now with that, but we are partners at the same time with the state on so many different things. We just need to continue to talk and make the case to each other because we have to work together on so many other things. There's going to be natural friction between each region and the state, like there has been at various parts of this process, because we want to be treated as a region. The state sometimes agrees with us on that approach. Sometimes they want to do things statewide. So that friction is going to be there at times. It has been there at times. And at the end of the day, by working together, we've gotten pretty good results.
Earlier this week, you asked the state to talk to some of those gym owners and other stakeholders in those industries. Did those conversations happen, and what did the state say to you about that?
There's been some conversations with some of these stakeholders in the state. We've been involved with them. I think the state is waiting on this air quality issue, understanding it more and having that issue, the stakeholders being comfortable with that issue in some of these facilities. I agree that this virus is brutal when it gets in a facility. We've seen that in nursing homes. We've seen that in a couple businesses where it's led to many, many cases. Whether or not that applies just to gyms and malls, an argument can be made. Then how does it apply to other large retailers or other small facilities that are open? So I think they got to. That's I think what's holding back some of this. And look at they could be out tomorrow saying, "We've done our diligence, we're comfortable, and we're moving forward." That would not surprise me, or it could be days from now. That would not surprise me.
Dr. Gupta, I don't know if you know this, but is there evidence to suggest that COVID spreads in HVAC systems?
Not at this point. We don't have much information about this. This is something we deal with a lot of indoor facilities, so it's to be determined. We'll have to look for more evidence.
Other questions?
Have we seen any new COVID cases among people who attended the big party last Saturday night on the outdoor West Side event?
So I don't know if we specifically, we can, through contact tracing, I'll ask Dr. Gupta to look into that. I don't know about last weekend's party. I do know we've been looking at and asking the question specifically related to some of the other gatherings, some of the protest events that have happened. We did not see cases from that. But certainly I'll talk to Dr. Gupta and her team about looking into that as part of their contact tracing.
Dr. Gupta, you said that right now you guys don't have much information about the HVAC and air conditioning systems. You said there would need to be more evidence. Do you happen to know what the evidence that they do have now is suggesting?
No, we don't.
Okay.
I mean, that's why this is something we'll have to look into more of that, yes.
Okay. So that would come from the state, I imagine?
What's that?
That information will come from the state?
Yes.
Okay.
I mean, that's what we look for. Mainly we look for the CDC and the state, both from, they have environmental health, a pretty big division, which works with us. When we had other issues with the environmental health, that's how it comes. But that's, it's a Legionella or anything else, so that's a separate area which we continue to work. So we certainly will be looking for more information from the state.
When you say there's no evidence, just to clarify, do you mean that there is nothing to suggest that HVAC systems spread the virus, or that study has yet to be completed?
Well, I don't know right now, so I'm not commenting on anything which I don't have much information about. Certainly I'll go back and look and try to look into. Previously we looked and we couldn't find any, but at this point, if something else new have come out, then certainly we'll look for that.
One more for you while you're kind of close to the mic.
Mm-hmm.
Do you know the breakdown of the asymptomatic cases? Are they mostly young people, or do you have any information about that?
So they most of the time they are young people. They range, they're mostly, young are the one which we have been They are being tested when we looked at the nursing home staff, a lot of them. That's how we started to see the pattern. Then there are other people when we had a lot of mobile clinics and a lot of people were going there. And when we call, when our staff will call, you're positive, they're kind of, what? So it's kind of a little surprise. So they went for testing thinking they might be negative, not knowing. But then they couldn't figure it out where they got exposed. And that's why, and most of it, they range, I mean, we'll have to go back and try to see exactly, but what I have seen the pattern is their majority of them will fall into the younger population. That has been, we had found some during even case investigations also when they turned from the context to cases because they just went and gotten tested. The families went and gotten tested. Like when we did the mobile clinics quite a bit, so there was no symptoms there. Maybe there was one case there, somebody they were exposed to, they thought, oh, let's get that tested. So we have seen all variable, but a lot of times as young population.
What do you classify as young?
Young will go from, you can think of from younger 15 to 30, 35, that's kind of range a lot of time. I mean, when we say very young, I consider myself young too.
Interesting answer by Dr. Gupta there. Yep.
We've heard that the Chase Bank branch in Lincoln Center temporarily closed because one or more employees tested positive. I was wondering if the county has any info about that at all.
I have not heard that. We have positive cases, so it wouldn't surprise me, just like any other business. If there's a positive case, there's going to be contact tracing, obviously with direct contacts with the employees and family members, and then they're going to look into contacts with potential direct contact with customers. Certainly in a bank, they would be able to talk about who was in for transactions, probably easier for contact tracing than many of the other businesses. But if it hasn't happened yet, I'm sure it will happen.
As we enter phase 4, how can we prevent becoming, another Florida or Arizona as we start to, fully reopen here?
Yeah, I don't know enough about what's really going on there. I asked the question earlier in the control room, do we even know, we've seen infection rates in some of these states, do we know if they're actually just testing symptomatic folks? If Texas, I read, had a 10% infection rate. If they're just testing symptomatic folks, that's a lot different, 10%. Remember, when we were testing just symptomatics, we're at 8, right? So think about where we were, and certainly we've made progress from now. If we were just testing symptomatic now, it would be less. But if they're testing everybody and they're at 10%, that's a problem, right? That's a big number. So I haven't followed enough what's going on there. There's a lot of speculation, but we've built up an infrastructure to live with the virus, and we have the ability to test, meaning if a business has one employee there and they have 20 other employees, we think that one person is positive, we have the ability to test every employee there to determine if there's anyone else who's positive. So let's take advantage of it. Certainly we've built up the infrastructure with tracking and tracing. So this is here. It's here to utilize. And again, when you look at the way that we tackled the situation in Oswego, cross county lines, so it's even more complicated, and that you quickly get in there, you quickly test all the employees, and then you isolate and quarantine. And then that cluster is done, and then you move on to the next one, right? So I think that's what will prevent us and people doing what works when it comes to physical distancing and wearing masks from some of these other upticks.
Ryan, when you were talking about the apple farm in Oswego, did you say we've had 42 cases since Monday of Onondaga County residents who work there?
Yeah, so with that facility, a partnership with the state of Oswego and Onondaga County Health worked together, got all the employees tested, and then from there, you essentially had half the employees when you add the Oswego County Onondaga County residents, and there might have been a couple other folks from other counties as well. But that's what you need to do. If you're going to have, and we have the ability for testing, if one business has one employee that comes down, we want to be able to reach out and offer a test to these employees so that we can quickly get to the root and quickly isolate and quarantine, and then that's over. It's done. We got to everybody. That's done. We're ready for the next one. And so it was good related to that collaboration. Our health departments are going to work together more, and getting that list from HR, that employee list, is critical in the process early on. That's why we're going to do an executive order saying businesses need to comply with our health department with that.
In the last week or so, you've specified cases that have come from travel. Are you concerned about summer and people moving around more and maybe spreading with those states that are having outbreaks?
Yeah, well, I think that's why you see the quarantine conversation happening from the state. It's part of living with the virus, though. You can't stay shut down forever because the virus isn't going to get to zero. If it gets to zero, I'm wrong, and I'll say I'm wrong, and everybody can say you were wrong, and I'll be happy. But we're going to have cases, and so you need to be smart to protect yourself. We've developed the infrastructure to fight this virus. That means that there's other parts of the economy that are going to need to open up, and there's risk with everything. And so we've mitigated that risk, and with the public's help, we'll continue to mitigate that risk. And then when we have a case, we'll do what we need to do, and eventually there's going to be a treatment for it and a vaccine for it. So each day we're smart, we buy time for our doctors and scientists to work on that treatment.
Have you been tested?
I've not been tested. I've not had symptoms. And certainly, I will say this, Trish, if this makes you feel better, one of my children had a procedure, they got tested, and certainly they would have been exposed to their dad, and they were negative. So that was kind of as close as it gets for Ryan being tested at this point. But certainly, in the event if I have any symptoms, I will get tested. Other questions? Okay, I just wanted to take the opportunity to thank many of you who've been following these briefings know some of the measures we've gone to deal with the economic storm that we are now in as far as budget crisis. Part of that was an early retirement package we put out for our employees. We had 160 employees take advantage of this. Today was the last day for a lot of them, and certainly I want to thank them for their service. Incredible public servants who have served this community so well for so long. Specifically, I wanted to thank our Deputy Attorney, Lori Tiroli, who 35 years of service to this county. She started in 1984. She served under County Executive Mulroy, Piro, and Mahoney, and many, many county legislative chairs, 5 county attorneys. And she is what you think about when you think about public service. So I want to thank Lori. I'm not going to tell you who she said her favorite county executive is that she worked under. Certainly I know the answer, but I don't want to get any of the other county executives she worked under mad, but we'll let people figure that one out. But please enjoy the weekend. We're going to do these briefings a couple times a week until we get through this. And certainly, I think it's important we remember we got businesses on the sidelines still. Many of us want to get them open desperately, and we need to continue to be cognizant with the public health. So there's no excuses for them not to be open. So certainly we'll be back at this Monday. Then we'll probably do it 2 times next week. So we'll probably do Monday and then maybe Friday again. But please enjoy the weekend and be safe. Thank you.